Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Repaglinide. Its brand name is Gluconorm. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, in this video, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Repaglinide. We'll then discuss examples of dosing, and then finish it off with side effects with percentages. I put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Repaglinide lowers blood sugar by stimulating insulin release from the pancreas. This is dependent on the patient having functioning beta cells in the pancreas. Its action is caused by an interaction with ATP-sensitive potassium channels on pancreatic beta cells. In terms of indications or reasons we would prescribe this medication to a patient, we would often see it used in the treatment of type 2 diabetes mellitus. With respect to contraindications or reasons we would not be able to prescribe Repaglinide, well, we wouldn't give this medication to a patient who had a hypersensitivity to Repaglinide or to any other component of the formulation. Patients with type 1 diabetes should not use this medication, as they should be treated with insulin, and this is the same for diabetic ketoacidosis. Medication should not be used with NPH insulin. As well, it should not be used in patients who have severe liver dysfunction. Now for dosing with Repaglinide, so in the treatment of type 2 diabetes, if after blood work the A1C of a patient is less than 8%, the initial dose would be 0.5 milligrams orally 30 minutes prior to each meal, 2 to 4 times daily. The patient may double the dose at intervals of 1 week as needed until they get the response they need. The maximum dose would be 16 milligrams per day. Now, if the patient's A1C was greater than or equal to 8%, the initial dose would be a little bit higher. It would be 1 to 2 milligrams orally within 30 minutes prior to each meal, again 2 to 4 times daily. For this medication, if a meal is skipped, you should skip the dose of Repaglinide. As with all medications, there are some side effects or adverse reactions that patients may experience while using Repaglinide, so I'll go over some of those here now. 5% of patients may experience diarrhea or a backache, while 5 to 30% may experience hypoglycemia or low blood sugar. Diarrhea may happen 5% of the time, and arthralgia or joint pain may happen 6% of the time. 11% of patients may experience a headache. Sinusitis comes in at 6%, and an upper respiratory infection may happen 16% of the time. One serious side effect with Repaglinide would be myocardial ischemia. Alright everybody, that's all we're going to talk about today with Repaglinide or Gluconorm. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.